We're going to go ahead and get started to go live. I'm going to go to this live and we're going to give this thing another go. And okay. Hello, and welcome to Let's Talk About It Tuesday. Okay, I see it now. We have Dr. Rashawn Broadnax, and it seems like we're working to get all the kinks and bugs out of this. It's kind of delayed. Hopefully he'll just pop back in. Trying to get things worked out really good. Hello, Rashawn.
Good evening. How are you?
I'm wonderful. We're just gonna keep going because I'm looking at it on one screen and it appears that it's doing pretty good, even though on my end it says we're having trouble with this video, but it seems like we're still online.
Mm-hmm.
Okay, well, let's just roll with it. How about it?
Let's go.
So how are you today?
I'm doing wonderful. I am doing absolutely wonderful here in Washington, D.C. For those who missed us last week, I'll formally introduce myself. I am Dr. Rashawn Broadnax. My business is called TRC Beauty and Hair Replacement. TRC stands for the red chair, and that's what you see behind me. So what we do at TRC Beauty is we focus on the restoration of healthy hair for clients who may have lost it for various reasons, as well as providing them with wig, toupee, prosthetic.
Prosthesis?
Yes, Lord.
Cranial prosthetics?
I'm having that moment.
It's okay.
Providing them with that so that they can feel really good about themselves. There's a lot of different hair restoration methods. We focus on the holistic side of that.
Great, great. You know, to me, this has been the most rewarding part of our business, working with people that are experiencing hair loss or that have had any type of head injury or scalp disorders.
Mm-hmm.
I'm loving the part where even during this pandemic, we are still able to keep our business going, and we're still able to service people. I've noticed with the wigs, what has happened because of the pandemic, and we're not like up close on, with the person, but we can service them because what I have done, Dr. Rashad, is I've made wigs for them because some of them can't come into the office,
Mm-hmm.
and it has kept business afloat very well, very well. Um, those that are listening, Dr. Rashad, is there anything you could tell them? Remember, we were talking about building the immune system up because we're dealing with this crisis where people are dealing with immunity problems, where I know this virus is out there, but what can we tell them that will help them to build their immune system up where they can continue to be healthy, So what would you say?
Sure. So I have advised a lot of my clients the number one thing that I really believe in when it comes to building your immune system and fighting off things is the use of ginger. So I really promote them to drink ginger teas, to get the ginger root and grate it and make their own tea. That will help boost and clear out your body, kind of inoculate against the toxins that could get into your body. But then also, like, we have the normal things, the vitamin C. I myself personally, my number one is the ginger tea. Number two, I do have an orange a day. And I believe that has kind of kept me really healthy throughout this period. A lot of the other medicines that I usually take, such as like allergy pills and things,
Mm-hmm.
I had to take, which was very surprising. I had someone share with me that steaming is a great method
Yeah.
to, kind of make sure that our nasal cavity is clear, because apparently the virus is holding on to the back of the nasal cavity. So if you steam and allow all that to drain out on a daily basis, that has kind of helped people with not getting the COVID in particular.
Okay, I can see that. I can see that. Here's something else. Some of our videos are jumping off, and
Mm-hmm.
that's fine. So we're gonna just keep recording because I'm gonna post this for whatever reason that's going on with it. It's not gonna stop our conversation. But I like what you said. A lot of people are drinking more teas now. They're realizing there's a lot of things that we can take into the body that will help build us up.
Mm-hmm.
Those that are dealing with, like one of my clients, she's dealing with arthritis, and she has a lot of underlying issues. So I told her, I said, well, let's deal with the thing that's uh, that gives you the more pain or whatever, and that was her arthritis. So we know that's inflammation
Right.
within the body. So I was telling her of different fruits and vegetables that she can eat that help with the inflammatory problems that she was experiencing.
Mm-hmm.
And so just getting her on the right regimen for that, to me, has changed her a lot. It's causing her to not to have to take so much medication, because we know medication has this synthetic base to it. And so quite naturally, you're going to have these side effects.
Mm-hmm.
So have you noticed or have you experienced some of your clients getting them to go natural? Has it been difficult?
For some people, yes, because, and I really don't fault them. I think we have just been a culture where we have grown to rely on medicines, and we rely on whatever our doctors tell us, and we've kind of moved away from holistic healing. And so one thing that we have to remember, and it was like you said, with a lot of medications, they have the synthetic bases. Our bodies are not designed to absorb synthetic material. It's designed to absorb the natural. And so the more natural you can put into your body, the greater absorption will take place, and the things will work with your body the way they're supposed to. When we have anything, even down to, say, foods that have synthetic portions to them, your body kind of dispels it. So the more natural you can put into your body, the better for you. And that's kind of the standpoint that I take with my clients, is letting them know that that's really the design of our body. And if you want to get the greatest benefit from something that you're intaking, try to maximize the natural portion of that.
And that, to me, that's one of the greatest keys is realizing how the body is designed. The body is designed to absorb all natural, because the body, think about it. If you have a car, certain cars require certain gasoline, types of gasoline. Now they have this electric car, and one of my clients got an electric car, and I went to go look at it, and it's so amazing to me because my car still put gas in it. But if you don't put the correct things in whatever your model is,
right,
it cannot function. So I can't drive her car and put gasoline in it when it's an electric car.
correct.
Okay, so here's our body. It's designed a specific way to absorb natural only and no synthetic. That means nothing man-made.
Right.
So the body is doing what it's designed to do. So if you're not treating your body correctly and eating correct food, you cannot affect, you can't expect your kidneys, your heart, any of those organs that are vital to function
properly. Correct.
No, so like you were saying, I think educating our clients is one thing. As cosmetologists, whatever your profession is that's dealing with a client, you have to be so up on knowing how this body actually works in order to help them understand how important it is to eat correct foods.
Right. Totally agree. And you know what's so funny that you say that, because we take that with just the normal function of the body and transfer that to how the hair grows and maybe why it's not growing. And when we have people that come in and they say, oh, my hair is breaking off, or, oh, my hair just won't grow. The one thing that we know to do is, okay, what are you intaking? It's almost like they don't even consider that. They think of everything else except what I'm taking in. One of the things that I push to my clients all the time is we have to drink more water. Most people think, oh, I had a glass and that was good enough. The more you guys, you can't see this, but I have a little wine glass with water in it. But the more that the more water you drink, the more toxins are released from the body. We have to understand how to not only bring in the right things, but how to make sure we flush things out.
And now that's good. That's good. That is so good, because elimination is important too. Now, we don't talk about this a lot, but I do have a chart I use sometime, and I give it to some of my clients, and it talks about your poop. And your poop, your elimination, your waste tells a lot about what's going on in your body. Different signs on whether it's loose or hard or whatever. It's actually telling you and giving you signs that something has gone terribly wrong in that body. A lot of us have done things, and we've eaten what grandma cooked, what auntie cooked, whoever been feeding you. And it's not to say that they've been preparing food correctly, but we've been doing it from generation to generation. And some of us are dealing with diabetes, hypertension, you name it. Well, it must be hereditary. Not necessarily. Not necessarily. If you're doing or eating like you were taught and you didn't know any better, you're going to get the same results or worse.
Exactly.
So your poop tells you a lot.
It tells the story.
Yeah, I mean, it sounds funny, and a lot of times I don't want to talk about. Well, you need to talk about it. You got to pay attention to everything that comes, as you said, comes out of the body. Just like what needs to go in, it has to come out.
Right.
And I don't think we talk about that enough. We kind of hit and miss, and kind of skate around.
It's not the prettiest thing to talk about. You're like, I don't want to talk about that. But like you said, it's very important. When you go to your doctor's office, they do ask,
They do ask. At least my doctor did.
Okay. And so, one of the things that I always share is that we are the doctors of hair. And
Yeah,
so if you want to know why your hair is reacting a certain way, whether it's growing a lot or maybe it's not growing enough, why it's breaking off, those are all the things we have to consider. What is going on with your body?
yeah.
What things are you bringing in, be it the medication or be it food? There's a lot of different considerations or factors to consider when you talk about this. So I think it's definitely may not be the prettiest thing to talk about, but it's definitely necessary when you're talking about figuring out what's going on.
And that's a lot of things that we need to talk about, we don't.
Mhm.
And I think that is one thing that has hurt us as a people. We don't discuss a lot of things. We won't. We're slow about getting certain things checked. And I've been guilty of that over the years. Oh, I got time. I'll do it next year. But my son just had surgery,
Mhm.
and he was having complications after the surgery, and we end up taking him back to the hospital. And I'm saying that to say this: when you start feeling discomfort, your body is letting you know something is wrong.
Mhm.
And he kept saying, well, if I just lay down, I'm gonna be okay, Mom, I'm gonna be okay. But we found out taking him to the hospital, when we did, saved his life,
Mhm.
because he had a blockage in his small intestines. And your waste got to come out somewhere.
Have to come out, or it becomes toxic to the body.
Absolutely. And it will kill you. And so, you know, we have to use wisdom. And I think I'm learning more and more, even dealing with this pandemic, this COVID-19. Some people are taking things so lightly, well, I don't need this. I don't need to put this on. I don't need to, I don't. But it could cost you your very life, because many people have said or thought that it was not that serious. And they're not here to even tell anybody anything.
About it. Hmm.
Yeah. So it's the same in our industry. We are doctors, and we need to take what we do serious, to the point where we need to give information. Listen, ask them, talk to them about their weight, find out what their blood pressure is. These are things, because some people don't understand what you put in, you feed to your hair,
Hmm.
you know, and as a result of some of the problems that we're facing or seeing, it's from poor diet, lack of exit. We can name a whole list of things that people take for granted,
Hmm.
you know. And so, so I agree with you on the what comes out is important too, just like what goes in. You had that glass of water. We need that water. I'm talking to myself. I'm talking to myself. But you know, um, to me, this is very vital.
Hmm.
And Dr. Rashad, just you becoming um, a specialist, a practitioner, a hair loss practitioner, or as I would love to call it, a hair, not so much as hair loss, we do a lot of regrowth too.
Right.
So, a regrowth specialist, uh,
Specialist. Exactly.
whether it's with the cranial prosthetic, medical wig, or whatever, but we do a lot of regrowth. When you get people that come into your facility and sit in your chair, what is the first thing you look for?
Um, well, the first thing that I'm going to look for is what is their reason for coming. And so a lot of times that's not just, that's not in analyzing the scalp, but it is in listening to the client as to what is their reason, because they will tell you. They're going to tell you what they've been experiencing, what they've been seeing with their own hair. So I want to hear from them, what is their primary concern. Then as I start to look at this hair and scalp, then I can kind of tell them what I'm seeing. And then
Okay.
we determine whether or not what you said and what I'm seeing, if it kind of goes together. So
That makes
that's pretty
sense.
much
Yeah.
like the first thing that I'm looking for is what is their reason for coming?
Coming. Now, I know that sometimes when people come, they're reluctant to let us know everything. They will give us minimal
Mm-hmm.
to mostly none information. But what I have learned, I sit and I began to listen. And because we can see, because we're professionals, there are some things that we see right off. And we kind of pretty much let them kind of talk and kind of lead up to it. And then we kind of ask a couple of questions that kind of help coach them into what needs to be done. But this is one thing that I've been seeing a lot of during this pandemic, and people are getting back into the swing of coming to get their treatments done or whatever. And because we've had so much time between us, a lot of things have changed or some things need to be, redone. But when they come in, my first thing is, okay, they said, come on, I'm ready for my treatment. Before we start that, let's talk. What's been going on? How you been eating? Because, I know when you're at home, you tend to eat some stuff that you're not supposed to have, or you may not stick to the treatment that we put in plan or whatever. And so, I've been seeing that a lot. And I just start, and like you said, I start listening or asking them, come on, tell me what has changed since the last time I've seen. Because you know what? Believe it or not, the smallest thing that they do or have done can make a big difference.
Change.
Am I right about that?
Absolutely. Absolutely.
So
that's why it's so important I feel like it's important, like you said, to let them speak. And while they're speaking, I'm listening for what's being said and then what may not be said. Then I will go back and start to ask a few questions that I really need the answer to. And usually I round out our conversation with, I really need to know the questions that I've asked you are really important to, our process here. So I need you to be very forthcoming with me with what may be going on so that we can treat you appropriately. Otherwise, coming here for a treatment and you haven't provided all of the information is not going to be as beneficial to you as you may want.
Okay, that's good. But and have you noticed, or have you put in place different approaches or different things that you're going to do different since you had time to kind of reevaluate and see? Because I don't care what nobody said, things are not going to be normal.
Absolutely.
They're going to change, and the way we approach our clients is going to change. And so we have to change our mindset on how it's not business as usual. In my
It is
opinion,
not.
yeah, because we had to. I don't know if you've taken the look exam, the barbicide, and the my ladies exam dealing with our sterilization and sanitation and stuff. Just revisited things that we should do anyway is helping, I think, putting us back where we should have been
right
before this even happened.
Right. And I think that's a great and important point, because on one of our other our happy hours, we discussed that, in sharing with each other how if we really had or were on top of our game in terms of sterilization, disinfection, bacteria control, all of that kind of stuff, our industry would be looked at a little differently, and we might not have been hit as hard when this took place. Because if we as a collective body are known almost like a doctor's office of having a truly sterile environment, a truly clean environment at all times, and working to keep it that way. I don't believe that. I believe we may have been closed, but we would have been open a lot more sooner, And so that was one of the challenges that I said to a lot of my friends
That was good.
who have salons is that's the challenge, to make sure that we really bring our salons up to that level. So in taking the barber side and the miladies training and things like that, as we're reminded of what we should be doing, let's put those things back into practice. So on a daily basis,
I like
and then also letting our clients know, the great thing I thought about the barber side training and the others is that you get that certificate. And I say to people, make sure you find a really pretty frame.
Please.
You put that certificate on display in your salon so that when the clients come back, they realize and see immediately that you have been trained on how to keep a sterile environment. It will keep them more at ease, as most people are going to be a little, skeptical about going back into these places, especially when you have, say, a salon with 4 different operators. That means that there's going to be 4 different clients there as well. So
that's
I
good.
think it's going to be a great help if you can do that.
Yeah, and I think I'm hoping that because we've got to do different things and put stuff in place, that we will change our views as the professional on how we portray to others that are looking at us as professionals. Now, when people see me sometimes, or they say, they'll call me Dr. Robinson, well, you're the doctor of what? And they go to talking about their health issues. So, well, let me explain who I am. And I began to tell them, but this the thing that really shapes me, is when they come in and you are knowledgeable about their health, about their organs, and you're able to explain to them how all this comes together as people say, oh, she's just a hairdresser, oh, she's just a beautician. No, so much more. And at first, just listening to people put us in this category, I kind of thought, well, shoot, they don't take us serious. We just, as I said, we fix it. That's why I don't like that phrase, I fix it. I don't fix it. I don't fix it. So it wasn't until I started digging deeper into this industry to realize there's so much more to learn. I mean, there is, oh God, there's so many avenues we can go in this, but it's how you portray it. When people look at you, Rashad, Dr. Broadnex, if I look at you and you don't take what you do serious, I'm not gonna take you serious either.
Absolutely.
I'm gonna treat you the way you treat yourself.
Exactly. I would say, just like you mentioned, how do people look at you when they walk into your facility? What are you doing? What are you portraying when you walk in? And I think as like we are on the level of the doctor, we have to keep it at that level. We cannot allow it to be diminished, because we want people to put their trust in us knowing absolutely how the body functions and how that contributes to hair growth or hair loss.
Right.
So when you come in, I don't necessarily want you to see, I want you to see me doing pretty hair. However, I want you to understand that there's more than just that you are coming here for.
Yeah, it's much more than that. I was studying, or I'm getting ready to do a trichology class, and as I was going over all that information, and I gave them the outline about trichology, right? And it was like, we got to learn all that. Yes. So as I was looking through some of the notes on my booklet, I got tickled, because I remember when I first started in this industry, I knew nothing about trichology. I didn't know, I'd never heard of it, okay? So I signed up. Hey, this is gonna be easy. It's an easy. I just learned how to do hair and blah, blah, blah. I found out I was so wrong. I was totally wrong. But when I took trichology, I was like, oh my God, this is gonna drive me crazy. Am I gonna even make it out of this class? Well, I said that to say this. When you're learning your cranium, how it operates, how it's nourished.
Mhm.
I mean, it's so many parts of this cranium that that you have to learn. And I was saying to myself, if I can go to school and learn all of this,
Mhm.
and now I'm teaching it, I cannot let anybody take our industry and bring it down
Mhm.
because it is so much, Dr. Broadnex, even to get to the place where we are today, that we had to do, had to learn, had to turn in homework, you know.
Well, I mean, even
You
down
know.
to the basic level of the industry, just to get your license to operate, when you go to school, most people are blown away with the idea that you have to learn anatomy and physiology.
Mhm.
And I worked in a school for 13 years, and I would talk to students all the time and be like, well, what do we need to learn this for? Because how are you going to understand that, how the hair grows? How are you going to understand the operation of the hair and scalp if you don't know what's underneath it,
That's true.
you
That's
know? And so we have to, and I impress that on persons that come to get their hair done as well. These are things that we know. So most often we sit and you see us doing hair, we're manually doing hair, but we know a lot more about what's actually going on. We know why we need to do things. We know
absolutely.
how to break down the different chemicals in the products, to understand what's going to do what.
And what will happen if or if someone comes in and they need a correction on their color or whatever, and I see a lot of that.
Hmm.
Come in, girl, I was trying to get this color, but this what happened. Come on, let's fix it. So it in my opinion, it's always a time for us to learn.
Hmm.
When I was talking to them about, when I was talking to different ones about making sure that you eat your green leafy vegetables and, just telling them different things to help build up the immune system. I was reminded when I was a little girl, my mother would make this garlic water. I
Hmm.
couldn't tell, I probably should have paid attention, but she would give us that, and we took her liver oil. It just, I had perfect attendance because I never was out of school, period. I always went to school, never was sick. Unlike, we have kids now, and some of them Stacy's respiratory problem. They got asthma, you name it, they got this, that, and the other. But it all boils down to having a healthy lifestyle, healthy eating regimen. I mean, excellent sleep habits. Now, but not only that, thinking healthy thoughts. A lot of times, well, I eat right, I do this, but you know what? We get full of so much garbage. And you know how they say, you are what you eat, you
Hmm.
are what you think too. So I share a lot of that. I think I talked to you all about emotions and how
Yes.
they affect different parts of your main organs, your lungs, your heart, different, your kidney. And if I'm not mistaken, I want to say anger attacks your kidney.
Hmm.
And one of my clients was like, well, how is that even possible? Your body is a fantastic machine
Hmm.
and everything works together. So when everything is functioning and everything is happy, everything works with each part. But if one thing is off,
It's like trying to operate a machine with no oil.
oh,
It's going to fall apart. That's why it's important that we keep all that together and working.
yeah.
Mhm.
So education is a key,
Mhm.
right?
Absolutely.
To whatever profession you decide to get into. Our institute, educational institute, is called Professional to Professional.
Mm-hmm.
And the reason why it's called Professional to Professional, because that student, and I think I got it behind me. You see the big P behind me is the professional, the licensed professional.
Mm-hmm.
And you see the two in the middle, and
Mm-hmm.
then that small P is the student's P.
Mm-hmm.
Okay, they're trying to get to the
Yeah.
big profession, the big P. And what I'm saying is that even though they're students or learners, adult learners, they're coming in. We starting out from a professional level,
Right.
even in the classroom, to help them get the mindset that this is how you got to think to get to the next level.
Right.
Okay, that's why I always make the announcement. You have to be licensed. I need you to have gone through something in cosmetology or something. People call me all the time. Well,
Right.
can I take your class without my license? It's professional to professional.
I mean, I think people have to think of this or put this on the level of continuing education, because that's exactly what it
Yeah,
is.
yeah,
So you have to have that foundation, the foundation education, which you would get in your beauty school. Um, you know, that is going to be your basis. We're not starting from the beauty school level when we come to P2P. You see what I'm saying? So
hmm,
it doesn't, it to me, it wouldn't make sense for that person to try to do that because we're starting at a level where you already have to have a certain level of understanding.
absolutely. And you know what? This has been wonderful.
Hmm.
I think I was either thinking about we do a segment on showing the cranial, how
Okay.
the blood actually flows in. Um,
You know what? Do I have mine over here?
do you? I'm gonna go get mine. Stay right there.
Okay.
I have this one.
Oh no. Okay. So I
Remember
have the
this
sensor.
one?
Yes.
And this one talks about the different parts of the head.
Hmm.
And I normally use this for helping, the temple. Most people think your temple is just right here.
Hmm.
Well, it actually runs from here to here. Okay. And so, just explaining the parts and helping people understand what each part is helps them understand and get a visual of how the cranial actually is set up. Now, this one is the one I think we're going to kind of talk about maybe in the next one. These are the how the blood travels
Right.
in the cranial. And I really love teaching this part because when people wear braids, mine not tight. I'm going to set the record straight. It's not real tight. But for those that are pulling and putting tension, you need to know where you're putting tension
Right.
and what can happen to that person if you put too much tension in certain areas of the head. So I think this is one key point that people don't know. This is what we learn. We learn this. We learn how to actually do, and I think you have the one with the pressure point, which
Yes.
is the one that if people come into the facility and they're having trouble with headaches or just whatever, we know the pressure. That's it. Yeah, you got it. Yeah, and those are the points of the head that are so vital. Yeah. Oh yeah. Look at this one. That's the stomach.
Mhm.
Yeah. Okay.
And then
Okay.
we have the ones on the back. There we go. Can we see? Yeah.
Yeah. There it is. The speech.
Balance,
Yeah.
vision, speech, and then leg and motor sensory.
That's great. People need to know. That's why, listen, some people that have had head injuries, And if it hit that area where the leg is, it can cause a lot of damage.
Right.
I think we need to talk about the hand. I talk about the hand and how the hand has the vital parts of your body, your organs, certain parts of your hand. If you've ever been to the doctor and sometimes they'll look at your nail tips, they're looking for something.
Right.
Okay. So these are things that as a professional, we have to learn those things because you come to us to get the help that you need. And some things are so simple as getting your stress level down,
A lot
and
can benefit from.
now right now, during this time, we should have a lot of people wanting to get that stress level down. So, and it helps us too as the professional, because you cannot help anyone if you're not helped yourself.
Right.
So we have to make sure we practice what we preach. I know I'm talking to myself, but there are so many things, and we can take time to go over this because I think some people that watch our videos need to understand these are things you need to learn. If you're having trouble with headaches, hey, this is what you need to do. If you can't sleep at night, here's one. For those that are having hard time sleeping, chamomile tea is excellent. The celestial sleepy time tea is very good, and I'm telling you, it's good for the body. The elimination is good. Also, if you want to take some melatonin, because the body produces melatonin, but if you're having trouble sleeping, yours is not functioning correctly now, because it's not habit forming. It's very good. You won't wake up groggy or crazy, but it's very good. Okay. And for those of you who can't get them children to sleep, they got them in gummies. Don't give but one. Don't give them two.
The melatonin gummy.
Yeah, they got it in gummies. So there are things that we can do. Right now, we need to start working on building our immune system. Because I think that's going to be the most important, because we've got a road ahead of us.
Absolutely.
Because this virus hadn't gone anywhere. It hadn't gone anywhere. Absolutely. And so we don't want to get so comfortable
to believe that, right, we're over that hump.
Yeah, because see, that's when it comes and bites you. So I think it'd be good, Dr. Broadnex, if we could give information to help those that are looking at the live or the replay to get their body pumped up with things that will build them up. We know vitamin C. You got to have vitamin C. You need vitamin E, definitely D. Now, I want to say this. Do not feel like you got to go to the store and buy every vitamin they have on the shelf. Because you can get a multivitamin that will cover it all. Because sometimes you can you can overdo anything. So you want to be careful, because I had one lady say, I take a B12, I take this, I take that. I said, first of all, you're taking too much.
And how about some of that stuff might be canceling out some of the other stuff that you're taking?
And it does. It does. And because you don't know, and you're just doing it because this sounds like it ought to be good. That's why we're here. We're not just the physician for just hair, as you all know it. We're here for the whole total person. And if you have questions or anything, and you want to ask us questions concerning any situation that you're dealing with, or you want to know how you can take supplements, I'm talking about natural supplements, that will help you to, build this immunity up. Because this is something, one thing I can say, our parents before us, the ones that was giving you those home remedies, they knew what to give you. And then we've gotten modernized and did away with a lot of things that we should have held on to. And now we got to go back to it. Those green leafy vegetables are still important.
Yeah.
Okay. Your water is very important.
Mm-hmm.
Okay. Even down to your rest, it's very important. The body has to have time to replenish.
Right. Rejuvenate itself.
And here's a good one, Dr. Broadneck. For the people that's really been busy all day, for those of you that can, you can do this in your bed. Bring your bottom all the way up to your headboard with your legs extended straight up in the air. Okay, and what it does, it aligns the body back up and allows the blood to flow back in for about maybe 10 to 15 minutes. No talking, just relaxation. And it gives the body time to get back in line and then get into bed. I promise you will sleep so good.
Well, you know what? I'm going to try that tonight.
Do
And
please.
you know how that works.
Look, don't go to sleep. Be up there so long you just and go to sleep because you're gonna wake up, something's gonna be hurting. But really, that's one thing. You have to allow the fluids and everything to get back. What you was about to say?
Or you won't be able to feel your toes.
No, baby, your toes will be, my toes gone. No, baby, you need to bring them down. And so, but that's one thing that quiet time is central to. Just time just for you to just, you don't necessarily have to forget about what has happened today. And just kind of relax and try to give your body time enough to get back in line. So again, Dr. Broadneck, it's time for us to go again.
Already?
Yeah. But we love what we do. We're here for anyone that need our help. If you need education, we have classes that are online and where you can take them, and it will help you understand. And I think we're going to start maybe an educational class for those that want to learn about nutrition, on how to get the body lined up. We'll be working on something like that, but we want to be a great service to our industry and the people that need our assistance on it. If you're losing hair, if it's thinning, if it's if it's unmanageable, you can get the help that you need. As Dr. Broadneck says, he's in the DC area. I am in Birmingham, Alabama, and we love what we do, and we've made a portal, so to speak, where people can actually talk to us and get the information that they need. Dr. Broadneck, is there anything else that you would like to tell them?
What I would say is, in terms of the questions, because I think that's very important. A lot of times when people see the videos, I know that questions come up. So I would say, how can they reach us? Personally, you can visit my website, which is www.theredchr.com. Or you can visit, not visit, but you can send me a message here on Facebook, or you can find me on Instagram as well. My Instagram is Dr. B, it's Dr.B_TRC. And that would be a great way to ask your questions. And one of the things I think might be good, Doc, is if we take those questions that we receive and we can bring them back the following week, so that more people can benefit from the answer.
I love that.
So definitely say, send your questions, send your queries, and we will do our best to get to all of them and then bring them back on the show. So tell us, how can they reach you, Doc?
Well,
since you asked.
You can reach me, of course, on Facebook. I can also be reached on, you can go to my website, which is Wigs by Suzette, and it's WIGSBYSUZETTE.com. Also, you can forward any questions that you may have to P2P information7@gmail.com. And what I will do, I will make sure I put the information. And Dr. Broadnax, make sure you send me your stuff so I can tag it to this video.
Okay.
Please share this video. And feel free to ask questions, because I know there's always questions, especially now. People wondering what's going on, what's happening. This is happening. But sometimes we wait too late to ask the question. But now is the time to ask. You can also give me a call. I'm going to give you my number, because my number is already still 205-503-9916. I am again in the Birmingham, Alabama area. It has been my pleasure. I appreciate Dr. Broadnax. I love his expertise. We may bring somebody else on next week. We don't know yet, but right now we're ready to answer any questions. Feel free to contact us. If you did not get his information, I'm going to make sure I post it along with my information so that you can send in your information. And we will bring back some questions. That's what we'll do. We'll bring questions that have been asked, and we'll talk about it on the Let's Talk About It. Okay? You want to say anything else?
Nope. That was it.
Be blessed, and thank you, Dr. Broadnax.
Thank you.
Will we be back next week?
Absolutely. Same time, same bat channel.
Well, listen, we're going to work on, we had some technical difficulties. Oh, producer in the back, hold on, let me see. He said the first Tuesday of next month. Oh, we're going to have a special interview. With who? Dr. Susan. Rodney, did you hear that?
That's a surprise from the producers.
Yeah, surprise, surprise, producer. But anyway, we're going to be talking, and I want you to make sure that you send your stuff in, because we do want to talk about it. We don't want to pass anything. And what I do most of the time, when I go back and revisit the videos, I look for questions or anything that people have put on there in the comment section. You can also put in the comment section between Dr. Broadnax and myself. We will get back with you. We will contact you. If you want to ask information about any classes, please feel free to contact me. I will give you information that will help you if you're thinking about moving up to another level in your business. We can do that, and we will help if you're having trouble with getting the insurance. Those of you that are already certified need to understand how this insurance works. We can offer that. We have now a new, Dr. Barnes, we do have another avenue. It's called P2P. This is an elite group, and it's for certified P2P people that have gone through the institute. We have an elite, and the reason why it's called elite, because things that we need to do far as getting our business, getting the insurance information, whatever we need, getting the vendors, it's in that group. It's not open to the public. It's a private group, and it's for P2P elite. So if you've taken a class and you're active, this group is for you, because the information we have is just for the group. And P2P is now a certified site for, let me get the name right, for the American Medical Certification Board. So P2P has really expanded and grown, and I'm very, very, very excited about it. So you're going to hear a lot of things that all of us that's active, we're going to be doing. So if you want to be a part of that and you've gone through the institute, you need to contact us. Get on there and fill out that questionnaire, and someone will get back with you and let you know where you stand in this group. But the elite group has a lot of things that you don't have to look for that I had to look for when I first started my business, especially those of you that is looking to turn your business into a hair replacement center or a clinic.
Mm-hmm.
You need this information. You hear me? You need this information.
Hear me.
Hear me. So we're gonna go. We love y'all. It's been my pleasure, Dr. Broadnax.
Yes, my pleasure as well. Always happy to be here and looking forward to coming back with some really interesting questions. So please make sure you send those in. And I would say try to get them in by Friday so we can spend the weekend researching and getting as much information as we can to bring back to you. So try to do that by Friday.
Thank you. See, he's brains. I'm beautiful.
Both brains, both beautiful.
Have a great evening. Okay? All right.
Bye-bye.
Bye-bye.